Well, you know, there are two sides to this argument. Of course, the president would say that all of these spending cuts of the sequester and the cuts that you're going to propose in the short term could actually hurt this kind of slightly improving recovery and throw us back into a recession. Let me ask you about a couple of the specific cuts that you made last year. Tell me if they're not in this new budget. I assume that they are. You cut Medicaid by $770 billion over the next 10 years. You cut $134 billion from food stamps. You cut $166 billion from education, training, and social services. Democrats say that makes you the party of austerity, that, one, this is going to hurt people who depend on these programs, and two, they say that rather than spur growth, it's going to hurt growth.
Well, we have 49 different job training programs spread across 9 different government agencies, lots of bureaucracies, they don't work. What we propose is to consolidate these programs into flexible grants that go back to the states to actually get people into jobs and into training so they can get back to work. So we get rid of the bureaucracy in Washington, we send the money back to the states so that people can actually get the skills they need to get the jobs they want. On food stamps, we basically say you actually have to qualify for the food stamp program to get the food stamp benefit. With our reforms, food stamps would have grown by 260% over the last 10 years instead of 270% like they did grow. And with respect to Medicaid, we think the Obamacare expansion of Medicaid is reckless. We're pushing people, 20 million people, into a program that's failing. More and more doctors and hospitals don't even take the program. So we want to reform Medicaid by giving states the ability to customize the Medicaid program to meet the unique needs of their Medicaid populations.
But
these are good
can you really say
that we think will make the programs better.
But can you honestly say that by turning Medicaid into a block grant and giving it to the states, that you can cut $770 billion out of that program over the next 10 years, and it's going to have no impact on legitimate recipients?
These are increases that have not come yet. So by repealing Obamacare and the Medicaid expansions, which haven't occurred yet, we are basically preventing an explosion of a program that is already failing. So we're saying don't grow this program through Obamacare because it doesn't work. Prevent that growth from going because it's not going to work. It's going to hurt people who are trying to help. It's going to hurt hospitals and states, and give the states the tools that they're asking for. Indiana is a perfect example. They have a fantastic Medicaid program that Mitch Daniels created in Indiana that is popular, that's successful, that's working well, but Obamacare prevents it from going forward. We want to give states like Indiana, states like Wisconsin, the tools they need to make these benefits work for their populations, and we don't want to push more people into a failing program. And by not pushing people into this failing program, we do save these kinds of dollars.
I want to pick up on this because I must say I didn't understand this. Are you saying that as part of your budget you would you assume the repeal of Obamacare?
Yes.
Well, that's not going to happen.
Well, we believe it should. That's the point. This is what budgeting is all about, Chris. It's about making tough choices to fix our country's problems. We believe that Obamacare is a program that will not work. We believe Obamacare will actually lead to hospitals and doctors and healthcare providers turning people away. It's a program that basically puts Medicare under the control of 15 people on a board that will determine what kind of benefits people get. That's a rationing board, however you slice it. We don't think healthcare is going to be improved in this country. We think it's going to look very ugly over the next couple of years. And that's why we're going to propose replacing Obamacare with patient-centered healthcare, with a better healthcare system for everybody, for the poor, for people in the states, for Medicare, so that we can actually have affordable health insurance for everybody, including people with pre-existing conditions, without costly government takeovers, which is what Obamacare represents. And yes, our budget does promote repealing Obamacare and replacing it with a better system.